ये सितंबर मंथ की 2023 विजन है, इसकी मंथली मैक्सिमम का कल्चर इशू है यूनिवर्सल हेल्थ कवरेज। रिसेंटली द ट्रैकिंग यूनिवर्सल हेल्थ कवरेज 2023 ग्लोबल मॉनिटरिंग रिपोर्ट वाज जॉइंटली रिलीज्ड बाय द वर्ल्ड हेल्थ ऑर्गेनाइजेशन एंड द वर्ल्ड बैंक WHO series coverage index. The series coverage index used to track the sustainable development goal 3.8 which indicates 4 indicators like reproductive health, maternal health, newborn and the child health, infectious disease, non-communicable disease, service capacity and access. It is measured on a scale from the 0 to worst to 100 to best. India scores a decline, पहले 63 था लेकिन इस बार 2019 में 64 था, अब 63 है. ओके, द रिपोर्ट एनालिसिस प्रोग्रेस टुवर्ड द यूनिवर्सल हेल्थ कवरेज यूजिंग टू सस्टेनेबल डेवलपमेंट गोल्स इंडिया यूनिवर्सल सर्विस कवरेज इंडेक्स. Service coverage index that covers essential health service and out-of-pocket universal health coverage service coverage index and out-of-pocket health expenditure measuring the catastrophic health spending. Okay, key findings of the report: universal health coverage service coverage index increased from 45 to 68 within 2000 से 2021. Okay, universal health coverage service coverage index 45 से कितना हो गया 68. The word is off the track to make the significant off track है, ठीक है. सिग्निफिकेंट प्रोग्रेस टुवर्ड द यूनिवर्सल हेल्थ कवरेज टारगेट सस्टेनेबल डेवलपमेंट गोल टारगेट 3.8 by 2023 as improvement to health services coverage have stagnated in 2015. The proportion of the population not covered by essential health service decreased by about 15% between the 2000 से 2021 with minimal progress made after 2015. The COVID-19 pandemic disrupted essential service in 92% of the countries at the height of the pandemic in 2021. In 2022, 84% of the countries still reported disruption. Catastrophic health spending and improvising health spending. Catastrophic health spending defined as the household health spending exceeding 10% of the household consumption expenditure. Improvising health spending. Out-of-pocket expenditure is considered to be improvising when it pushes household below a predefined poverty line or further into poverty if they are already poor according to that poverty line. Keep finding the universal health coverage service coverage index increased from 45 to 68. Okay, the proportion of the population not covered by essential health service decreased by about 15%. Okay, with minimum progress made after 2015. The COVID-19 pandemic disrupted essential service in 92% countries at the height of the pandemic. In 84 countries still reported disruption. The proportion of the population that faced catastrophic levels of the out-of-pocket health spending has increased. Financial hardship is more prevalent among the poorer household, mostly due to the higher rate of improvising health spending rather than catastrophic health spending. एक है catastrophic health spending, एक है improvising health spending. Key dimension of universal health coverage: access to health service, financial risk protection, quality of service. Service should be adequate, effective. That is quality में बढ़िया होना चाहिए. Adequate, effective. Financial risk protection: people should not fall into debt paying for treatment and care. Access to health services: everyone who needs services should get them, not only those who can pay for them. Universal health coverage is important. Universal health coverage means that all people they have access to a full range of quality health service without financial hardship. ठीक है. Universal health coverage means that all the people have access to a full range of quality health service without financial hardship. It covers the full continuum of essential health service from health promotion to prevention, treatment, rehabilitation, and the palliative care. Okay, and a palliative care. Importance of the universal health coverage. Universal health coverage and its importance. Universal health coverage means that all people must have access to a full range of quality health service without financial hardship. Universal health coverage and its importance. Universal health coverage means that all people have access to a full range of quality service without financial hardship. It covers the full continuum of essential health service from health promotion, prevention. हेल्थ को प्रमोट करो, अगर होगी तो प्रिवेंट करो, देन ट्रीटमेंट, रिहैबिलिटेशन एंड द पैलिएटिव केयर. इंपॉर्टेंस ऑफ द यूनिवर्सल हेल्थ कवरेज: मैक्सिमाइजेस द ह्यूमन कैपिटल बाय मेकिंग इन्वेस्टमेंट इन health, which is crucial for both the educational attainment in children and workforce productivity in adult, which promotes economic growth. Workforce productivity in adult, educational attainment in children. Well-functioning health system with equitably distributed healthcare infrastructure increase the demand for skilled job. अगर वेल फंक्शनिंग हेल्थ सिस्टम है विद इक्विटेबली डिस्ट्रीब्यूटेड हेल्थ केयर इंफ्रास्ट्रक्चर, वेल फंक्शनिंग हेल्थ सिस्टम विद इक्विटेबली डिस्ट्रीब्यूटेड हेल्थ केयर इंफ्रास्ट्रक्चर इंक्रीज द डिमांड फॉर स्किल जॉब. well-functioning health system, equally distributed healthcare infrastructure, increase the demand for the skilled job. It helps in achieving sustainable development. 3. Good health and the well-being help to reduce the social barriers to care and distribution of the health resources between different population groups and empower the patient in decision making. What are the challenges in achieving the universal health coverage? Low healthcare spending. As per the economic survey 2022, the central and the state government budgeted expenditure on healthcare increased marginally from 1.6% to 2.1% of GDP in financial year 23, which is among the lowest in the world. Lack of financial protection. As per the Nadi Young, at least 30% of the population is devoid of any financial protection for health due to the existing gap in coverage and overlap between the scheme. Out of pocket expenditure. India's out of pocket expenditure as a percent of the current health spending is 47.1%. in our global average कितना 18%, India में 47.1%. Equitable access. Rural communities in India suffer from significant access to healthcare, such as lack of the qualified medical professional, physical limitations like distance, lack of established healthcare infrastructure, and inability to pay for the necessary medical treatment. As per the Lancet. Okay, what are the initiatives taken to achieve the universal health coverage? Ayushman Bharat Yojana, it aims to undertake intervention to holistically address the health at the primary, secondary and the tertiary level. Ayushman Bharat Digital Mission, it will improve the equitable access to quality healthcare by encouraging the use of technology such as telemedicine and enabling national portability of health service. Ayushman Bharat Digital Mission, it will improve equitable access to quality healthcare. कैसा होना चाहिए? Equitable access to quality healthcare. Ayushman Bharat Digital Mission, it will improve the equitable access to quality healthcare by encouraging use of technology such as telemedicine, enabling national portability of the health service. National Health Policy 2017, it aims at achieving the universal health coverage and delivering quality healthcare service at an affordable quality होनी चाहिए, affordability होनी चाहिए. Intensified mission Indradhanush, it focuses on reaching the zero dose children aged between 0 and 5 years and pregnant women who might have missed any vaccine doses in the national immunization schedule. Inequitable access. Rural communities बता रही है. the Lancet publication 2000, the provision of the core health service lack uniformity across the state and district hospital. Core health service lack uniformity. Health service में uniformity नहीं है across the state and district hospital. Only 60% of the district hospital in Tamil Nadu, they offered all the case service. In state like Assam, Punjab, Madhya Pradesh, Mizoram and UP, it was found to be just 1%. Okay, lack of medical manpower. India has faced a shortage of the healthcare professional, including doctor, nurses, paramedical staff, which impaired the delivery of the healthcare service. Now, what are the recommendations from the report? Adopting a primary healthcare approach can improve the health system. अगर primary healthcare approach बढ़िया रहेगा तो healthcare system बढ़िएगा. Health system accelerates the progress toward the universal health coverage, expansion of the essential service, especially for the non-communicable disease, removing financial barriers, that is issue of indirect cost and the co-payments in the healthcare. Strong commitment to international health regulation, inaccurate public health risk, increased public spending. Government spending should be increased to around 5.2%. That is the average health spending on the lower and middle income countries. Government spending 5.2%. Decreased to around अभी कितना है 2.1% of GDP. Address the structural weakness with the healthcare delivery system, that is lack of medical supplies, healthcare workers, irrational treatment. They can be addressed by engaging the private sector, civil society and expanding the medical seats बढ़ा दो. Engaging the private sector, civil society and expanding medical seats. Central state coordination. Central government should adopt a collaborative mechanism. कैसा मैकेनिज्म होना चाहिए? कोलैबोरेटिव. allowing for the flexible policy making and differential financing from the center to the state. Flexible policy making, differential financing from the center to the state. Central government should adopt a collaborative mechanism. ठीक है. allowing for the flexible policy making and differential financing from the center to the state. This will also allow the state to better meet the diverse collaborative mechanism, flexible policy making, differential financing. This will also allow the state to better meet the diverse requirement and develop health plans that are consistent with the needs and the requirements of the population. Next topic is Ayushman Bharat Digital Mission. Recently, the National Health Authority organized National Health Authority NHA. They organize आरोग्य मंथन 2023 to celebrate 5 years of आयुष्मान भारत प्रधानमंत्री जन आरोग्य योजना and 2 years of आयुष्मान भारत डिजिटल मिशन. अगर हम और डिटेल में इसको देखें, just a second. Okay, where is it? Just need to put on. Okay. At the event, the state and utilities that excel in various categories they were awarded. Highest आयुष्मान कार्ड क्रिएशन, सबसे ज़्यादा आयुष्मान कार्ड क्रिएट कहाँ पे किए गए थे? वो है असम, नागालैंड, जम्मू एंड कश्मीर. असम, नागालैंड, जम्मू एंड कश्मीर. नेक्स्ट है हाईएस्ट परसेंटेज ऑफ यूटिलाइजेशन इन पब्लिक हॉस्पिटल. कर्नाटका एंड त्रिपुरा में सबसे ज़्यादा यूटिलाइजेशन हुआ है. नॉट टॉप स्टेट इन जनरेशन ऑफ आभा स्कैन एंड शेयर टोकन, उत्तर प्रदेश. आभा स्कैन एंड शेयर टोकन, उत्तर प्रदेश. टॉप स्टेट इन लिंकिंग द हेल्थ रिकॉर्ड विद आभा, आंध्र प्रदेश. आयुष्मान भारत डिजिटल मिशन बाय नेशनल हेल्थ अथॉरिटी की बात करते हैं 2019 में एक्सेस ऑफ नेशनल हेल्थ एजेंसी. मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर क्या आता है? इट इज शेयर बाय द यूनियन मिनिस्टर फॉर द हेल्थ एंड फैमिली वेलफेयर. एपेक्स बॉडी रिस्पॉन्सिबल फॉर इम्प्लीमेंटिंग द आयुष्मान भारत प्रधानमंत्री जन आरोग्य योजना. इट डिजाइन द स्ट्रेटजीज, बिल्ड टेक्नोलॉजिकल इंफ्रास्ट्रक्चर एंड इम्प्लीमेंटेशन ऑफ द आयुष्मान पैथो टेक्नोलॉजी strategy, build technological infrastructure, implementation of Ayushman Bharat digital mission. Ayushman Bharat digital mission to develop the backbone which is necessary to support the integrated digital health infrastructure of the country. एक backbone बनाता है that is necessary to support the integrated digital health infrastructure of the country. Implementing agency, national authority under the Ministry of Health and Family Welfare. The digital infrastructure under the scheme is being developed by adopting the India Enterprise Architecture Framework. India Enterprise Architecture Framework that is released by the Ministry of Electronics and Information Technology. India Enterprise Architecture Framework ये एक holistic framework है for streamlining, standardizing and optimizing the e-governance effort across the country for interoperability and integration. India एक holistic framework है. It streamlines India Enterprise Architecture Framework released by the Ministry of Electronics and Information. India Enterprise Architecture Framework मीटिंग ने किया. ये एक होलिस्टिक फ्रेमवर्क है. इट स्ट्रीमलाइंस, स्टैंडर्डाइजेस एंड ऑप्टिमाइजेस द ई गवर्नेंस एफर्ट अक्रॉस द कंट्री फॉर इंटरऑपरेबिलिटी एंड इंटीग्रेशन. आयुष्मान भारत हेल्थ account number, a randomly generated 14-digit number generated through self-registration purpose. It identifies the individual, then authenticate them and threading their health record only with the informed consent of the patient across the multiple systems and stakeholders. Identify, authenticates and threading their health record. A personal health record application available on Android and iOS platform. It allows the self-uploading scanning of existing physical health record as a diagnostic report and prescription, etc. Abhaya. Health Facility Registry. It is a comprehensive repository of all the health facilities of the country across different systems of medicine. It includes both the public and the private health facilities including hospital, clinic, diagnostic laboratories and imaging centers, pharmacies, etc. Health Facility Registry. Healthcare Professional Registry. Health Facility Registry, Healthcare Professional Registry. It is a comprehensive repository of all healthcare professionals involved in the delivery of the healthcare service across both modern and traditional system of medicine. Significance of the mission for patient. It will empower the individual with accurate information to enable the informed decision making. किससे क्या करेगा? It will empower individual. किसके लिए? With accurate information to enable the informed decision making and increase the accountability of the healthcare provider. It will also ensure the transparency in the pricing of the services and provide the option to access health service remotely through teleconsultation and e-pharmacy. It will also ensure the transparency in the pricing of the services and provide the option to access the health service remotely through teleconsultation and e-pharmacy. It will also ensure the informed decision. It will empower the individual with accurate information to enable the informed decision making and increase the accountability of the healthcare providers. Empower individual with accurate information to enable the informed decision making, increase the accountability of the healthcare provider. It will ensure transparency in the pricing of the services and provide the option to access the health service remotely through teleconsultation, e-pharmacy. For healthcare professionals, they will have better access to the patient medical history for prescribing more appropriate and effective health intervention insurance claim. It will help digitize the claim process and enable the faster reimbursement. It will help digitize the claim process. It will help in digitizing the claim process and enable faster reimbursement for policymakers. Better quality of the macro and the micro level data will enable advanced analytics, better preventive healthcare, strengthen implementation, monitoring of the health program and the policy. Ensure claim. It will help digitize the claim process, enable faster reimbursement. Better quality of the macro level data and the micro level data which enable the advanced analytics, better preventive healthcare, strengthen the implementation and monitoring of the health program and the policy. They will able to study and evaluate the effectiveness of various program intervention. Key achievements of the Ayushman Bharat digital mission as of September 2023. 45 करोड़ आयुष्मान डिजिटल आभा कार्ड क्रिएट बन गया. 2.18 लाख हेल्थ फैसिलिटीज रजिस्टर्ड. 224 लाख 218 हेल्थ फैसिलिटी, 224 लाख हेल्थ केयर प्रोफेशनल, 3 करोड़ हेल्थ रिकॉर्ड्स लिंक विद नेशनल हेल्थ अथॉरिटी एनुअल रिपोर्ट. Challenges क्या digital divide, illiteracy make it difficult for certain section of the population to adopt the Ayushman Bharat digital, high cost, the digitalization of medical data, poor interoperability between states with data migration and interstate transfer, facing multiple errors and the shortcomings, capacity building and digital skilling of the medical professional needed to prepare them to use the digital tool, concern about the personal data security and privacy following the recent ransomware attack on the All India Institute of Medical Science AIMTERI has brought question of the safety and privacy, limited awareness among the citizen about the app and its use. Health is a state subject. There are these are the state schemes. There are state schemes and initiatives that have some vision and mission as Ayushman Bharat digital mission tending to the multiplicity of effort. For instance, the e-health initiative by the Kerala way forward, protecting details of the patient through the methods like anonymization and ensuring that the health records of the patient remain entirely confidential and secure, encourage research and development in digital health technology, especially in areas like AI, machine learning and predictive analytics, streamline the process and standardization of medical data, ensure the smooth transfer of data between the state, increase public awareness to ensure that citizens understand how to access and utilize the digital healthcare services available, introducing the concept of Ayushman Bharat digital mission and digital health in the curriculum of the medical professional, incentivizing the private provider to participate in the process of digitization of the medical health record. Example, the digital health incentive scheme. digital health incentive scheme aim to incentivize stakeholders such as hospital, lab, etc. to adopt a digital health ecosystem. The gender snapshot 2023 progress on the SDG goal. The gender snapshot 2023 report released on the United Women UN Department of Economic and Social Affairs. UN Desha. Sustainable Development Goal 1. No poverty. Over 340 million women and the girls they still live in extreme poverty by 2030. Progress will need to be 26 times faster to reach SDG 1 by 2030. 340 million women SDG will live in extreme poverty by still live in extreme poverty. SDG no poverty करीब नहीं तो हंगर नहीं. Close to 1 in 4 women and girls they will experience moderate or the severe food insecurity by 2030. Addressing the gender gap in agri food system can reduce food insecurity and boost the global GDP by nearly 1 trillion. SDG 4 quality education. Only 60% of the girls they have computer schooling at upper secondary level compared to 57% of boys. Only 60% of the girls have computer schooling at upper secondary level as compared to boys. Okay, gender equality. Next generation of women will spend an average 2.3 more hours per day on unpaid care and domestic work than men. As digital and reduce inequalities, women are twice as likely as men to report instances of discrimination based on sex, and almost twice as likely as men to experience discrimination on basis of marital status. SDG 30 climate action. 158 million women and girls globally may be pushed into the poverty as a direct result of the climate change. 158 million. Major challenges in achieving in SDG. Violence against the women. Less participation of women in labor force, education gap, wage disparity, women's basic income. Tamil Nadu launched the Kalaignar Magalir Urimai Thogai women basic income scheme. Kalaignar Magalir Urimai Thogai. This scheme will provide a monthly stipend of ₹1,000 for eligible women who hold less than specified land and annual family income is between age about 20 years old are eligible. Other state Karnataka में भी है, मध्य प्रदेश, पंजाब has similar scheme for women as per the economic survey 2016-17. Universal basic income for women and has large multiplier effect on the household. UBI has 3 components: universality, unconditionality, agency by providing support in form of cash transfers to respect, not dictate recipient's choice. Arguments in favor of UBI, argument against UBI. Treat beneficiaries as agent and enter citizens with the responsibility of using the welfare spending as all individuals are targeted. The exclusion error, poorer being left out is zero, provides a safety net against the health income and other shock, encourage greater usage of bank account leading to improvement in financial inclusion. Argument against, it might make people lazy and out of the labor market. Gender disparity as men are likely 1000 में क्या ही आउट भला ही होगा भाई जो लेबर मार्केट से निकल जाएंगे. जेंडर डिस्पैरिटी एज मैन आर लाइकली टू एक्सरसाइज कंट्रोल ओवर द स्पेंडिंग ऑफ द GBI. ओके, UPI ये हो सकता है. कैश ट्रांसफर परचेजिंग पावर में सीवियरली be curtailed by the market fluctuations. High burden on the government budget. Malavia program, the teachers training program. UGC Malavia teachers training program Malavia mission was launched. Malavia teachers training program, it is supported by restructuring of the existing schemes and the capacity building of the teachers under the Department of Higher Education. It measures the capacity building and training for the faculty and the staff across the higher education institution in the light of the National Education Policy 2020 within 2 years through multiple training centers. Human Resource Development Centers will also be renamed as Madan Mohan Malviya Teachers Training Center. Digital infrastructure for knowledge sharing. Digital infrastructure for knowledge sharing. National E-Governance Division under the MeitY is set to integrate the personalized adaptive learning PAL into existing Diksha digital initiative. Digital infrastructure for knowledge sharing. PAL, personalized adaptive learning. PAL is a software-based approach that allows each student to have an individualized learning experience. Diksha एक initiative of the NCERT Ministry of Education. Key service of Diksha, it provides quality e-content for the school education in state and UT, QR coded energized textbook for all grades, One Nation, One Digital Platform, One Nation, One Digital Platform, QR code, hit energized textbook. One Nation, One Digital Platform. Enable the visual impairment to access the website using assistive technology. Special e-content for visually and hearing impaired at digitally accessible information system. Deemed to be university, NCERT has been granted the status of the deemed to be university. Deemed university status will now allow NCERT to offer its own graduate, postgraduate, and the doctoral degree have autonomy in terms of the introduction of new program, course structure, conducting examination and management among the institution of higher education other than the university. Doing the work of a high standard in a specific area can be declared as an institution deemed to be a university declared by central government under section 3 or the UGC Act 1956. NMC gets